Hi, my name is Rob Palumbo. I'm an orthopedic surgeon and sports medicine specialist from the United States. And I'm here in beautiful Medellin, Colombia, and I'm visiting BioAccelerator Clinic, a stem cell clinic here. And I'll tell you, it's my second time being here. I haven't been here for a couple of years, and the difference is just amazing. The area that the clinic is in is gorgeous. Medellin is just a beautiful city with wonderful people, very friendly, very easy to get around. The clinic itself is in a medical tower that's actually part of a beautiful mall, and on the other side of the mall there's a beautiful hotel that I've been staying at, very comfortable. And that's basically how our guests do the same thing. They tend to stay at the hotel, and while they're getting their treatments down here, they get to spend some time at the mall. And also, the wonderful people at BioAccelerator also help to set up some excursions around the really gorgeous area of the country. And it's my second time here. It's been more exciting this time. What's really made it more exciting is that the differences in the clinic. I've been part of the concept since before it even came to Colombia, and what it was when I first got here. I think there were 6 employees or 7 employees when I got here. Now I think we're at 21 with 4 or 5 doctors and then consultants that come in, and a wonderful staff of nurses and a wonderful scientific team of PhDs and graduate level microbiologists. And it's been just wonderful to see the growth and wonderful to see the science that's behind it. And you know, I've been doing biologics in my practice for over 15 years. Started with a technique called prolotherapy, which is really just a very old technique, but sometimes very helpful. But I've always said with any of the residents or fellows or medical students that I've taught, I've said, you know, the answer is in the cells. And I've always said that for the past 15 or 20 years. And every year we're getting closer and closer. And when I see the science that is here right now, what we've accomplished, I'm sorry to say that I've known that what we do in the United States is really biologics light. We can't do what they're able to do here with the cells. When we do techniques in the United States, we do the best we can, and we often use the patient's own cells, but we never know really how many cells we're using. We never know really how the quality of the cells are. Here we're very, very specific on the type of cells that we get. It's from, we get the cells from warfarin jelly, which is a substance within the umbilical cord from natural live births that the mothers donate the cords themselves. And then they're able to get pure, early, non-differentiated cells that we're able to multiply and incubate and really get cells that we know the quality of the cells. We know the amount of cells. So we know when I see the treatment protocols that they've developed here over the last couple of years, it's amazing how far they've come. Knowing exactly the amount of cells they're putting in to whatever they're doing, whether it's intra-articular, into the joints, say the shoulder, the elbow, the knee, the hip, know exactly what the amount they put in. And then if they do for neurologic disorders, you know, they have a neurosurgeon that's doing the injections into the spine. For some of the orthopedic procedures and injections, they have a wonderful sports medicine physician and orthopedic surgeons that come into the clinic and do it as well. Very well. I'm always amazed at how, first of all, how friendly and wonderful the physicians and the nurses are, but how technically skilled they are and how knowledgeable they are. It's really been outstanding, and it's been very wonderful to see since I've been down here. It's exciting to be working with them. I'll tell you the experience. Obviously, we end up taking care of a lot of athletes, and that's part of my involvement. I've been taking care of professional and elite athletes my entire career. But what I've really seen this week is some of the more devastating injuries, brain injuries, spinal cord injuries, really life-altering injuries that that we're really treating people in ways and getting results that I would not have imagined in the past. So, and that's what really makes me feel good about this technique and this center. The results we're getting and the wide variety of patients that they're helping here is amazing, and that makes me feel good to be part of it, and to watch it grow is just amazing. And I couldn't have had a better experience while I was here. I don't think anybody that would travel to be here would be disappointed. First of all, like I said, Medellin is gorgeous. The people are just so wonderful. The staff here at BioAccelerator are just great, and they make the patients so comfortable. And what's also very special here, it's not just the cells that people are getting, it's not just stem cell treatments, it's everything that's surrounded that. The use of hyperbaric oxygen treatments during the stay here, during the week of stay. They also use bioregulatory infusions that help optimize the treatments. They're intravenous treatments that, are done once or twice during the stay while they're here. And also, they really treat things globally here, and that's something that's not done everywhere else. Also, they're very, very, very diligent on taking care of the whole patient. There's a functional medicine physician that is very involved with regulatory hormones and seeing what supplements and what other deficiencies the patients may have. There's also a psychiatrist that works from time to time with patients. There's physicians that will, at the end of the week, really put a program together for what is expected of the patient over the next several months and what they could do, lifestyle changes as well. So they really do a comprehensive treatment of the patient. It's not just during their stay here. It's ongoing, and that's really the way to make it work. So I couldn't be more proud to be associated with the clinic here, and I look forward to coming back more and more. Whenever they let me come down to Medellin, I'll be here. But for anybody that is thinking about this technique, it's something that they have representatives that you could talk to, and then once you go through talk to the representatives, you will have one-to-one consultations with the doctors over the either by telephone or by video conference, and they could answer all your questions and see if you're a real candidate or not. And the other thing I like about just that process is that if you're not a candidate, they'll tell you that, and that's something very special about this clinic as well. It's just not a hammer looking for a nail, as we say, and they really take their time and find out everything they can about the patient and know if they can help and what they could help, but also are very honest about what the expectations could be going forward. So, like I said, it's been a great second visit to the clinic. I look forward to coming down and seeing it grow and working with the staff and the physicians here. It's been a great experience so far, and I look forward to continuing to do it in the future.